Hi, Supervisor. Today I will be discussing the case of Jake, my initial thoughts on the first session. From there, I'll go on to elaborate his symptoms and any potential underlying influences I believe there is under his behavior. Then from there, I'll be going on to describe the chosen modality, the short-term and long-term goals for his therapy. Okay, firstly, a quick overview. Jake is a 35-year-old male who has sought therapy for his anxiety. Jake has suggested his anxiety has been heightened due to a recent promotion, and that he says that he's been experiencing anxiety throughout his life. He then suggests that he has high standards for himself, potentially indicating perfectionist thoughts. And says that this is related to his therapy. He also identifies internal pressure that he has. That's something that's caused issue. Some of his concerns specifically include tasks taking longer. He's been more worried about making mistakes. He's been checking things repeatedly and agreeing to unrealistic deadlines, becoming very stressed, and always seems to have a massive to-do list that he never gets done. Jake also expressed a worry about this impacting his other relationships, this being with Cherry, his partner, and as well as his boss. He's scared that his boss will regret promoting him. Jake has also stopped doing specific coping things that he enjoys. This was basketball with his friends on a Friday afternoon. So with the increased responsibility at work, it seems that the internal pressure that he described is also increased, then going on to create more anxiety. These increased feelings of distress can be viewed as a symptom of an anxiety disorder. Due to the changeable nature of anxiety disorders as a whole, and the individual nature, it is hard to kind of get a good idea if which kind of anxiety disorder it is. I believe that he meets some criterion for adjustment disorder. That is because of his difficulty with worries, and these worries being related to his concentration and functioning at the workplace, and all of this being related to a significant change in the recent past being his promotion. Although there is not enough evidence to make a diagnosis as of yet, and this should rather be used as a prognosis to maybe better understand Jake's case and his symptoms. So some further investigation into the cognitions that Jake experiences can kind of show some maladaptive thought patterns. We can observe this as some of his in a dialogue he describes. He describes his high standards. He talks about his brother saying he's highly strung. This potentially relates to him either having perfectionist schema, as I discussed before, or maybe having unrealistic standards for himself. We can use Beck's tripart model of emotion, which poses thoughts, feelings, and emotions are all interrelated, to suppose that maybe these thoughts are relating to his anxiety. And then with this in mind, we can better understand and see how his new role, his maybe struggles in performing maybe some of his more usual things. And then as a result, he's kind of becoming quite anxious about this. Jake also exhibited some good protective factors during the session. Primarily, I'd like to highlight his relationship with Sherry. This was his primary motivating factor for seeking psychological aid. It was her suggestion in the first place to get him into therapy. Another important one I thought was maybe the group of he plays basketball with. Although the basketball is a good coping mechanism, he also has a group of friends and potentially a social support network that he may be able to rely on. Something that needs to be investigated a bit further is his family situation, whether or not he has some support there, or whether that's maybe another cause of stress or other emotions. I'll also go on to kind of list some important factors that maybe can facilitate his therapy. This mainly being the therapeutic alliance. Although we've only had one session, the alliance isn't established yet. And maybe something that's important to keep in mind of is setting expectations for Jake about how we will go about therapy and some things that he can expect from therapy, as well as maybe a bit of a description alongside the psychoeducation that I'll go into further later about kind of what we'll focus on, and maybe disponging any ideas of folk psychology that he might have already. Another important factor is the therapist's effects. That's more the therapist's ability to contribute to therapy themselves through skill, experience, their understanding of Jake and so forth. And this is important to monitor as it can contribute to improved therapeutic outcomes. Now that I've briefly discussed these problems and maybe some important factors to keep an eye on, I'll discuss my chosen modality. This is the CBT, based off Beck's tripart model, as discussed before. The aim of the intervention as a result will be impacting either behaviors or cognitions to alleviate Jake's anxiety. This intervention is considered to be the gold standard by a recent systematic review, and it should be mentioned that research on adjustment disorder is a bit limited, though this is consistent across all anxiety kind of disorders. The next session will begin with a quick discussion about recent additions to Jake's symptoms or situations, anything relevant to discuss. Following this, I believe psychoeducation is what needs to be focused on next. This aligns with the CBT treatment modality. Through this, I plan to kind of suggest or address some of the thought patterns that contribute to Jake's experience, maybe highlight some that he describes to me, being the perfectionist one, maybe I talked about earlier. In line with the CBT modality as well, I'll also introduce maybe some behavioral techniques, this being mainly breathing techniques or progressive muscle relaxing, to help provide Jake with a bit of coping skills to manage his anxiety while we are going through the beginning stages of therapy. This can also be important as some bringing up thoughts and stuff like that can also be quite distressing for patients. So making sure that he has something to rely on and maybe practicing some of those skills during the session is important. These are aligned with the kind of short-term goals for therapy, being to elaborate on the underpinning factors on Jake's anxiety through interviewing, as I discussed. Other techniques such as journaling and homework can also be important to get a better picture for Jake outside of the session if he's struggling inside the session. Another maybe short-term goal is to kind of get Jake to identify and maybe some of these underlying beliefs, and maybe pull him up when he does kind of fall back on these beliefs. Jake's anxiety levels needs to be kind of kept under direct supervision too, as a part of the short-term goal. And keep in mind, if at any point, if he's experiencing heightened or other symptoms, that maybe we can shift therapy as a result. And then finally, the long-term goal for CBT as a whole is to restructure kind of thought patterns, promote healthy ways of thinking. As a result, we will aim to confront the established thinking patterns with the goal of developing alternative perspectives. This may look like confronting Jake's supposed perfectionism in attempts to replace these thoughts with something a bit more realistic, maybe sort of saying, or the internal pressure kind of thing, and maybe I'm new at my new role and I've got increased responsibilities. It's okay if I'm less efficient for the beginning of this kind of thing, or maybe it's okay to be less efficient overall. Thank you.